What are the underlying root causes that lead to the blood vessel dysfunction? Simply asking your patient to stick out their tongue and put their tongue, because if your blood vessels are too constricted and your heart is choking against every single heartbeat.
Hi everybody, welcome to the Kidney Coach YouTube channel. I'm naturopathic Dr. Fiona Chin, co-founder of the Kidney Disease Solution and head formulator at Kaigenesis, and I am so thrilled today to be joined by the amazing Dr. Ellie Campbell. So let's dive in. So let's talk about this oral hygiene, and of course people listening are going to have kidney disease, but as we know, cardiovascular disease is the second leading cause of kidney disease and changes in kidney function. And sometimes we have patients where you can do everything left, right, and center and you can't quite get the blood pressure where it needs to be. Or it sounds like if you're not really treating this driver, you're still going to have changes in blood vessel health and endothelial health. So let's dive in. Walk me through this.
So I think that if we go back and we think to ourselves, what are the underlying root causes that lead to the blood vessel dysfunction that is probably at the root cause of all three: heart attack, stroke, kidney failure, right? It's about the blood vessels. And what leads to that blood vessel dysfunction is really two things. It's oxidative stress and it's inflammation. And if we're not finding the root causes of those oxidative stressors or that inflammatory trigger, then we're not going to get all of those things removed. You know, in functional medicine, we have a thumbtack rule. We say if you're sitting on a thumbtack, it takes a lot of Tylenol and morphine to make that thumbtack feel better. And if you're sitting on two thumbtacks, removing one really didn't make your problem 50% better. So this is what happens with oxidative stress and inflammation. We might remove 2 or 3 or 4 of those causes, but if there's one remaining that we've missed, like I did in D, I missed that one thing, then the events can happen. But if we find them all and relieve them all, then longevity is our next step, right? We're going to have a long and healthy life without those complications, without time in the hospital for heart attack, stroke, and without needing to go onto dialysis. So some of those root causes, many of them are connected to the mouth.
Yeah.
So we start by looking at the mouth structure. Like, who would have thought that the shape of your face and your mouth are connected to your blood pressure in any possible way? But first of all, we'll talk about a tongue tie or a tongue tether. So many people are unable to put the tongue on the roof of their mouth. And that's the happy resting position of the tongue. It should sit in the roof of your mouth, not in the floor of your mouth while you're sleeping. And if your tongue is tethered to the floor of your mouth, you can't ever get it up in its healthy place. You tend to live in sympathetic overdrive. You don't stimulate your vagus nerve the way that you should. We need to get that vagal stimulation going by having the tongue up where it belongs. And so simply asking your patient to stick out their tongue and put their tongue on the roof of their mouth can be a very simple intervention that you go, oh my goodness, we need to get you to a functional dentist or a myofunctional therapist, which is like a physical therapist for the mouth, lips, and tongue, and get that tongue retrained to sit in the correct position. So that's one simple example.
Wow.
Right? Another one.
Yeah,
it's so simple and yet so overlooked. Another thing, you tip their chin up and look at their nostrils. Are their nostrils symmetrical? Because if they're not, and if they rapidly breathe in and one side sucks in and the other does not, there's obstruction there. Why is that important? Well, we have this miracle molecule called nitric oxide. You might have heard of it. It's so important. It won the Nobel Prize, right? This is a gaseous signaling molecule. It's one of the few gases that has many downstream effects, and it dilates blood vessels. In fact, it was this research in dilating blood vessels. They were trying to invent a drug that did this nitric oxide pathway, trying to invent a drug to treat blood pressure. Because if your blood vessels are too constricted and your heart is choking against every single heartbeat, your blood pressure is going to go up. But if we can dilate those blood vessels, your blood pressure is lower. They invented this blood pressure drug. It was terrible at controlling blood pressure. But all the men came in and said, ooh, guess what? my erectile function is so much better. And they labeled that new blood pressure drug Viagra, and they never sold it for high blood pressure. But you know what they did sell it for? Erectile function. And it works through the nitric oxide pathway. Well, where is nitric oxide made? It's made in endothelium. It's made in lots of places. But the primary place it's made is in the floor of the nose.
Really?
So if you are not breathing through your nose, you will not have optimal nitric oxide levels.
Hence
if
why
you have
no good.
Being a mouth breather is no good. And if you suck in and you have obstruction on one side, and I look at your nose and you got one big nostril and one little itty bitty nostril, I know you have nasal obstruction. I know you're not nasal breathing well at night. I know you're not making nitric oxide, and you have all these downstream effects. So I send you for a CAT scan or to the ears, nose, and throat doctor, and we talk about maybe some sinus surgery or nasal airway remodeling. We teach you how to breathe through your mouth, and all of a sudden your blood pressure drops 20 points because we got this obstruction corrected and your nitric oxide levels where they need to be.
Thank you for being part of our audience. And Dr. Campbell, thank you again for your wisdom, your time, and pioneering the way in just helping people live better, healthier lives.
You're so welcome. It's my honor.
All right, everybody. We'll see you next time. Thanks again. Bye.